According to the different pathology we can find in the spine, we decide which kind of treatment would be the best for each patient. Sometimes the same patient can have both things, cervical spine disease and lumbar spine disease. And we have to figure out perfectly with the physical examination, a questionnaire to the patient, and the analysis of the studies, the image studies, which one of them is the main problem at that specific time. Why is that? Because I think we need to have a perfect picture of the patient in order to fix the main problem at the time he is asking for. Although we can find in the image studies that it's a problem in the cervical spine, but the main problem is pain in the lower back and sciatic pain and everything, we have to attack that problem first and then reevaluate how the cervical problem is behaving, okay? So I'm going to explain to you some things that we need to do sometimes. There are some patients that have narrowing of the spinal canal, for example, in the lumbar space, in the lumbar spinal canal, and that narrowing can be happening in one level because of herniated disc or bone spurs, or mainly in older people, older than 70 years old. It's very common that we can find narrowing in different levels. When the narrow canal is happening in 3 or 4 levels, we need to take out some quantity of bone, some amount of bone, in order to take out the roof of the spinal canal and decompress all the nerves. When we do that, we make cuts of the bone. Here you can see in the lamina, we take out the spinous process and the lamina, and then we drill the bone till the foramen where the nerve roots exit here. So we can be sure by direct vision with the microscope, the surgical microscope, be sure that the nerve is decompressed and all the nerves are decompressed. When we do that, we take out bone, we also have to detach ligaments and muscles. So when we took out everything of that, we can leave a spine that is going to be unstable sometimes. So we need to evaluate that in order to decide if at time of surgery we need to stabilize that spine. And when do we need that? We use a system of transpedicular screws. This is an example of this system. The transpedicular screws goes through the pedicle, which is this structure here, to the vertebral body. That way we can solve the problem of instability and take out load from the spine in the diseased discs and give the patient stability to that segment. At the same time, we are decompressing the nerves.